health, financial, and home improvement. Enjoy being educated in such topics as personal injury law, community association law, family law, bankruptcy law, along with health show topics like pain management, men's health, and dental implants. Now, sit back and enjoy today's Ask the Experts with host Steve-O.
Hey, good evening. Welcome to Ask the Experts. We're with you every Monday and Thursday night from 6 to 7. I got to tell you, our first expert tonight, is a true trooper. Now, how many times would you have the top urology center in South Florida, one of the senior partners, get a kidney stone while he's on vacation? I mean, who ever heard of that? And he's on the show tonight live. Let's welcome Dr. Eric Shenvin, Broward Urology Center, Mr. Kidney Stone. Bro, I cannot believe you still wanted to do the show.
Well, it's out of me and busted up and cleaned up, and the pain has been gone since Saturday. So why not, make hay while the sun is shining?
Well, the only thing, I guess, positive is when someone gets a kidney stone, you really know how painful it is.
I think I definitely have a better perspective with my patients. I've always believed them because women tell you it's worse than child labor and so on. Just make my speakers a little lower. But it was definitely some severe pain, and I would have passed it and tried to pass it, which would be nice. Most people try and pass their kidney stones,
right?
But I was just living from pain pill to pain pill, and the next step is the person who just can't even get comfortable and gets admitted to the hospital. So I didn't.
You knew it right away what it was.
Yes, and I've been talking about it for a few months now, and now unfortunately living it, about these things.
Yes.
That do more than protect us, but they cover up our mouths, and it really has cut down my drinking. This has always been by my side, and it's been very close to the water cooler. So I really have to pay more attention to it now, because really dehydration is really the number one cause of kidney stones. So
is it really?
Absolutely.
But you're so young, though.
The pollution.
Age doesn't have anything to do with it at all?
Not really. I mean, kids can, but stones are rather uncommon in children. But once you start getting into your 20s, 30s and up, we're in the stone belt here in South Florida, and it's just the heat, so people are expending a lot more heat, and if they don't drink enough, we certainly see waves of stones probably about 2 to 3 months after the summer, where they've gotten the dehydration, they've had a chance for these stones to crystallize in the kidneys, and then now they start to grow and then eventually fall out of the kidneys. So usually somewhere in that October range, it starts raining stones in the ER and in our offices and so on.
So you were on vacation when this happened. Thank God. Yes. It was towards the end of your vacation.
It was towards the end. I had one more day of skiing to do, and 2:00 in the morning, after having a rather spicy Mexican meal for dinner, I kind of figured I was waking up with an upset stomach, and then I just knew something wasn't right, and my mind started going a mile a minute. Could be this, could be this, could be this, could be this, and then once I sort of settled my mind down, I said, "Oh no, the urologist says may have a kidney stone."
Yes.
Went to the ER and got checked out.
Did the spicy Mexican food have anything to do with it?
I don't think so at all. And this stone had been growing for a while.
Okay.
Certainly, it's got 8 millimeters long and 5 millimeters wide. So it was a good sized stone. it's there's been articles written about the barometric changes when someone goes on a plane, when you're at a higher altitude, the potential at least of causing a stone to move, maybe fall out of the kidney, move further down the tube on its way down if it's passing. And that may have played a role. And you're still, when I ski, I seem to ski overly hard, and
Oh, you're Black Diamond.
well, I'll do black diamond singles, but not
Okay.
doubles. I'm not crazy. I still
Okay.
need to walk, and but I'm sweating, and it's cold, and you're sweating, and you're
Right.
up at a higher altitude. But it's not an acute event. This has been going on for a while now. It's like I said, it's I just haven't been drinking enough. I really haven't, and that's the biggest problem.
Can you make somebody, is there anything you can do medically to make someone pass a stone?
Yes. So the typical thing, of course, when someone gets a kidney stone, if they can tolerate it, they come to our office. If not
Okay.
too bad, but most people end up going to the ER because it is some really severe pain. And when you either get admitted or get discharged from the ER, we usually send you home with a medication that is or is like Flomax, which we use in guys for enlarged prostates. So it was kind of found out, probably around 15 years ago at this point now. It's not that old, about using this medicine. Prior to that, people have tried for years and years to find something to help stones pass. Well, we use Flomax to kind of help relax the prostate and open the channel up to let the urine out. And they found out that in using it in kidney stones, it can relax, and men and women for the kidney stones, it can relax the tube that called the ureter that connects the kidney to the bladder. And if it relaxes it enough, it kind of helps the stone slide down and have a better chance of coming out.
So you came back from your trip. Did you have the surgery done in your surgical center?
It was actually done at the hospital. It was done at, I happened to be at Broward Health Medical Center because that's where I think the machine was. My partner had been doing another case. And honestly, this week, I knew looking ahead at the schedule, we all had a really busy week. And I kind of had to be on my game for this week, and my partners weren't going to have much time to deal with me either.
Right.
So I kind of arranged things for the day after I got back. I went to work a little bit, trying to keep my mind off of things, and saw a few patients, and then headed over to the hospital for my testing and surgery. I did the shockwave procedure.
Once you've had the stone removed, does it lay you up for a long period of time? Is it still painful?
Well, I can answer that personally now.
Yes.
And say yes, it can be. I certainly went in with pain.
Yes.
And my blood pressure was a little elevated, and I sort of said, let's get this going. After the fourth time, they stuck me to get an IV in. figured being the doctor, but the pain was gone initially afterwards, but the next day it came back, and I definitely needed some pain medicine for the next 36, 48 hours, because if you think about the stone as a whole, when we blast it with the shockwave, the non-invasive external shockwave machine, it breaks it up and cracks it into tiny little pieces, multiple cracks. So sometimes it explodes and it's just gone into dust. My stone, of course, had to be one of the hardest type of stones. You could tell because when I was passing the pieces, they were black, dark black, which is usually a calcium oxalate monohydrate stone, the hardest type. So the stone can kind of crack, but then it takes time as urine gets in between those cracks and expands, and then the cookie starts to crumble. So as it moves a little bit, you may feel a little bit of pain, but as the pieces pass out and the obstruction gets relieved, that's where the pain goes away, as the urine is no longer backed up.
So was Dr. Shenvin a good patient?
I was a very good patient.
Okay.
Everyone said how nice I was. It must be a contrast to, I
Well, you're a
guess, when I
good
come in
guy.
there. But
So I want to kind of change the subject around, and we're glad you're doing better. I'm hearing it's scaring me because I'm in my 60s. It's scaring me about prostate cancer. I'm hearing people that I actually know who are passing away that it was prostate cancer. Did those people not do testing for prostate cancer when they were younger?
some of them, yes. Certainly, the patients that did not have any medical care and that unfortunately show up with the cancer that's already outside the prostate, spread into the most commonly the bones. And some of them are just unfortunately men that have a more aggressive cancer, like any kind of cancer, that when we end up diagnosing them, it may be already outside the prostate. There now again, the screening, the PSA blood test, at the least of which certainly should be done once a year, and if that's out of range, certainly for someone's age, and there are age race adjusted ranges. We don't just say if it's over 4, it's bad now. The guy's in his 50s, it might be 2.5 as a limit. If his guy's in his 70s, it could be as high as 6.5, and it even depends on the size of the prostate, because as it might make sense, if a bigger prostate, more prostate is more tissue makes more PSA. So we as urologists have always stood firm on screening guys for prostate cancer with a PSA and a rectal exam, a prostate exam. Honestly, takes 2.5 to 3 seconds to save your life on a once a year basis for the most part. And we generally start at 50 if there's no family history, 45, sometimes a black gentleman, and certainly people with a family history.
We're going to go to break. Eric, give everybody the phone number at Broward Urology Center.
Our phone number here is 954-463-6408, and you can find us on the web at browardurologycenter.com.
Folks, this is the finest urology center in South Florida. We're going to go to break, and I've got more questions about prostate cancer when we come back.
Sounds good.
Are you suffering from erectile dysfunction, also known as ED? The urologists at Broward Urology Center can help men regain their sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408.
And we are back. This is the Ask the Expert show. We're on every Monday and Thursday from 6 to 7. Drive time on 1470 AM, 96.9 FM, 95.3 FM. Or you can go to iHeart and listen to the show and just put WWNN Radio in. And if you want to watch the show, you can actually watch the show live by going to Ask the Experts, Steve-O Host. And you can actually view our shows. We're here with Dr. Eric Shenvin. He has got the finest urology clinic in South Florida. He won't say that. I can say that. And it's just all state of the art. But men, especially men, there's things that we need to do that we should not wait till the last minute. And one thing is our prostate, right?
For sure.
And especially because I was telling you, I hear all these people passing away from prostate cancer. And I wonder how many of these people actually went in at an earlier age instead of waiting till it was too late. And I guess that's the people who pass away waited till it was too late.
I think, a good majority, at least 50% of them, but there are definitely men that, like I said, come with more aggressive cancer and it's already spread by the time we find it. That said, in the last 8 years, there has been an explosion in prostate cancer management. And it is honestly every 6 months, we almost have to relearn how to manage these patients because it is changing that rapidly. There are multiple oral, I wouldn't call them truly chemotherapy medicines, but oral hormone medicines that we use. Some now chemotherapy pills also in treating these patients, not just the hormone shots that we use to knock out the testosterone when it's spread outside the prostate. Now, understand most of the cases are contained to the prostate. And some of the guys that we diagnose don't even need treatment. We put them on active surveillance and watch them and do a biopsy every couple of years, something along those lines. So there's a wide spectrum from sort of the patients that you're putting out there, which do exist, versus even the patients that, we try and figure out who needs a biopsy and who doesn't, but we do find insignificant, what we refer to now as kind of clinically insignificant prostate cancer that we'll still watch to see if it changes, but at this time really doesn't even warrant treatment.
So tell me what an enlarged prostate is.
So the prostate, first of all, is a gland that wraps around the urethra, which is the urine tube that basically comes from the bladder all the way to the outside in a man, and only men have a prostate, not women. So in a man, it runs then through the penis to the outside where the urine comes out. So the prostate is right next to the bladder and wraps around it, and the ejaculatory ducts plug in through the prostate into the urethra, and that's where all the components of the semen, including the sperm, get deposited into the urethra to then go out and fertilize an egg. The prostate makes PSA. That's that blood test that we check. And PSA is actually involved in the fertility process, helping sperm kind of get out of the semen to go fertilize an egg. That's really all the prostate does, other than become a nuisance as we get older. And I'm trying to remember your question. I got
what is an enlarged prostate?
Right. So guys can have, as guys get older, not everyone, I kind of use the 80-20 rule 80% of the time. Guys, the prostate grows, and as a guy gets older, the prostate has more time and it gets larger, and it causes more obstruction. I like to describe it as a donut that wraps around the urethra. The donut hole is the urethra, and the cake, or the donut itself, is the prostate. So as the cake grows, when it grows out, we put a finger in the rectum, we say, the prostate's getting larger. But as it grows in, it starts to squeeze that donut hole down, making it tighter and tighter, so it's harder to get the urine through that narrower hole. And so you can have an enlarged prostate, you can have prostate cancer, you can have either or both together even. Any and all of those combinations are possible.
How do you reduce an enlarged prostate?
So, first of all, just the concept that you came up there is astute, certainly, and we've had for a while, but not really until the 20th century that we have any means to really reduce the size overall. So that's the concept of shrinking the prostate.
Okay.
And basically these medicines, Avidard and Prostar, finasteride, dutasteride are the generics. We use those, and over time, and it really takes about 9 to 12 months to see a difference, they can reduce, by blocking the enzyme that converts testosterone to dihydrotestosterone, which is really that final component that's food for the prostate, growth factor, if you will. It blocks that. And nothing is absolute, but you can actually reduce the size of the prostate and help with symptoms long term. Reducing it from inside and really opening up the channel then involves something surgical, whether it's an office procedure like the newer Resume procedure we're doing here in the office, where we heat the tissue up by poking a probe through the urethra with a scope. We poke a probe into the tissue and it delivers steam and heats it. So you can kind of think of the donut being a grape, and the grape is a raisin. So as you put it out in the sun or you heat it up, as the raisin or the donut shrivels up, circumferentially now the raisin, the channel will now open up. We have other means of like the Urolift, where we can pinch the lobes together, very quick procedure for the office and the operating room. And then the larger procedures for bigger prostates, guys that come to us in urine retention, like a green light laser, where we're kind of doing a rotor-rooter job, and this guy's saying scraping out or lasering out, vaporizing the tissue on the inside, and the classic comparison where we're literally scraping away the tissue and have to evacuate the chips in the prostate.
You know what? My phone has been going off from listeners, and I got to ask you this because last time you were on, the same guy asked the question. We ran out of time. This guy is a 86-year-old male. This is how he puts it. I used to be able to urinate like a racehorse. Nowadays, it comes out very slow. Do I need to come in and see you?
So I kind of expressed the way I'm going to express it to you. I expressed that to a few patients today. To some extent, there's bother, right? So he's 86. Maybe,
Yes.
you know, when he was 68, if he had called us then and said, you know, my stream's not really what it used to be, but I'm not really bothered. I get up maybe once at night and not a big deal. I don't really want to take any medicine. If he came in, we might evaluate and make sure he is emptying the bladder completely. But as long as he's not getting infections or any consequences of the enlarged prostate at 86, certainly he's okay. But many men are bothered by that weak stream, the slow stream, sometimes dribbling down their leg, not being able to get all the urine out, waking up multiple times in the middle of the night, where I think a lot of these guys get so used to waking up in the middle of the night, they don't know what a good night of sleep is anymore.
Right,
I
right.
get up 7, 8 times at night, but I go right back to bed. I said, so those are the guys when they come back after surgery, most of the time in that case surgery, because they're more severe symptoms. They come back and they say, listen, I haven't been this rested in 25, 30 years. And so, you know, men are very stoic and will put up with a lot. I think women are more apt to tell you.
Wow. So does he need to come in and see you?
I think if he's thinking about it, then he's bothered enough by it.
I got you.
Then yes.
Okay.
Even if it doesn't mean he's going to have surgery or even an office procedure, but it might mean we might be able to help him quite a bit, make his quality of life a lot better just with the medication, even something like Flomax, something like those shrinking medicines, more for the longer term. You know, at 86, now we'd like to keep this guy out of the operating room. So using at least either the shrinking medicine like the Avidard and Proscar, along with something like Flomax, that Flomax is going to give more of a instant now kind of result to open the channel and let the urine out, but it's also a Band-Aid because it doesn't do anything. The prostate will continue to grow. So that's where those other medicines as a combination may be helpful to look not just for the now, but in this 86-year-old or whatever age there is, we're looking down the road because when he's 88 and 90, we're going to be even less inclined to want to take him to the operating room.
You know, I was worried about, after hearing about your kidney stone, how we were going to do the show tonight. It was so easy to do. You've got such great information. And I mean, we've had 6, 7, 8 people text us with questions. I'm going to keep these questions, and next month when you're on, we're going to start off with these questions first. I promise everybody. Give everybody your phone number, Eric.
It's 954-463-6408 for Broward Urology Center.
And Eric will be back with us again next month. Broward Urology Center. It's the finest center, most up-to-date center in South Florida. So it doesn't matter where you're at, whether you're in Palm Beach or Dade or Broward. It's an amazing facility. And like I said, Dr. Shinman will be back with us next month. And we're going to go to break. When we come back, we're going to be doing our next show.
Steve, I got one quick question for you. What's that flamingo behind you?
I don't know. What is it, Freddie?
Those are hands.
It's a what?
Hands.
Oh, it's a hand.
Ah,
Hand.
very kind. Yeah, I could see that. Okay, very colorful.
Last time you had a question was, can I get a hat? Bro, I love you, Eric. We'll be right back.